Good afternoon and welcome to the Technical Assistance Network for Children's Behavioral Health, Cultural and Linguistic Competence Peer Learning Exchange. Peer Learning Exchange is a webinar or monthly call with topics focused on promoting health equity and eliminating disparities in children, youth, and young adult behavioral health systems. Topics are generated by you, individuals working in and being served by or partnering with behavioral health organizations and systems of care within states, communities, tribes, and territories. The TA Network, as it is known, is part of the National Training and Technical Assistance Center for Children's Behavioral Health for the Substance Abuse and Mental Health Services Administration, commonly referred to as SAMHSA. My name is Selena Webster-Bass. I'm the CEO of the Voices of Children Research Group, focused on health equity, cultural competence, and well-being in children, youth, families, and serving organizations and systems. I am also a core partner of the Cultural and Linguistic Competence team of the TA Network. Today's webinar is titled Youth, Racial Stress and Trauma, Conceptual Framing and Applied Clinical Strategies in Youth of Color. Today's discussion will address the impact of racial stress and trauma on youth of color across developmental periods and present clinical recommendations to assist youth of color in coping with this form of trauma. In addition, our speakers today will address racial stress and trauma in the context of COVID-19 webinar, and I'm excited to welcome the experts that will be leading this important discussion today. Let me begin with Dr. Farzana Salim. Dr. Salim is a University of California Chancellor's Postdoctoral Research Fellow at the University of California, Los Angeles. Dr. Salim has a joint appointment in the Semmel Institute for Neuroscience and Human Behavior and the Graduate School of Education and Information Studies. She received her PhD in the Clinical Community Psychology program at the George Washington University and completed a child and adolescent clinical internship with a specialization in trauma at Children's Hospital, Los Angeles. Dr. Salim's research is focused on understanding how to reduce the negative consequences of racial and community stressors on the psychological health and well-being of African American adolescents and other youth of color. She uses a strengths-based lens to understand the benefits of racial, ethnic socialization, and culturally relevant protective factors across the family, neighborhood, and school context. We'll also hear today from Dr. Rihanna Elise Anderson. Dr. Anderson is Assistant Professor in the Department of Health Behavior and Health Education at the University of Michigan School of Public Health. She earned her PhD in Clinical and Community Psychology at the University of Virginia and completed a clinical and community psychology doctoral internship at Yale University School of Medicine. She also completed a postdoctoral fellowship in applied psychology at the University of Pennsylvania, supported by the Ford and Robert Wood Johnson Foundations. Dr. Anderson uses mixed methods in clinical interventions to study racial discrimination and socialization in Black families to reduce racial stress and functioning. Dr. Anderson is the developer and director of the EMBRACE intervention, EMBRACE standing for Engaging, Managing, and Bonding Through Race, and loves to translate her work for a variety of audiences, particularly those whom she serves in the community via blogs, video, and literary articles. Before we get started with our important discussion, I just want to remind everyone that this presentation is being recorded. Your lines will therefore remain muted to help eliminate the background noise. So please feel free to use the chat box to type in any questions or comments during the presentation, and we'll work to address these. Under the public chat box where you can comment and ask questions, you should see a box labeled Files that includes a downloadable copy of the PowerPoint being used for the presentation today. And finally, please stay on with us a few minutes following the webinar to make sure that you complete the evaluation that will automatically appear upon its conclusion. Next slide. Next slide. So our learning goals for today are to discuss the impact of racial stress and trauma, or what we refer to throughout the presentation, RST, on youth of color across developmental periods, to introduce the developmental and ecological model of youth racial trauma, or the DEMYth-RT model, an approach to understanding how racial trauma impacts the child, family, and community. We'll also address various clinical and community-based strategies to assist youth of color in coping with racial stress and trauma, and discuss stress and trauma, or RST, in the context of the COVID-19 pandemic. So at this time, we'll transition over to Dr. Anderson, and we will be entitled 3.5 minutes, just a segment from this video, so take a watch. Thank you.
Jordan Davis's mother and father wept throughout the trial, at church, and at the thought of missed opportunities. The documentary 3.5 minutes, 10 bullets focused on the trial of Michael Dunn, a white 45-year-old man who killed Black 17-year-old adolescent Jordan Davis. Although Dunn's lawyers argued self-defense, the jury eventually returned a verdict of guilty for murder in a trial that shone a light on the problems associated with racial stereotypes, fear, and gun-related policies. Perhaps most harrowing, however, was narrative conveyed by Davis's father in the movie when he recalled the racial socialization he provided to Jordan in prior years. Watch what you say. Take care of yourself, because there are people out here who will do things that they shouldn't do. Davis's father believed that Jordan acted out of anger when he responded to Dunn's request to lower the music in his friend's car, ultimately leading to his demise. I wonder, did Jordan ever tell his father how angry he felt at the need to stay in line? Did Davis's father ever share his own anger or encounters when even he was unable to keep his cool? Was there ever time devoted to practicing and managing these feelings within the family, so that Davis's father would not carry the burden throughout his life? Understanding these questions about racial stress and trauma and how to navigate these challenges for Black youth will be the focus of our message in today's webinar. So we wanted to start with just defining some terms with respect to what we'll be talking about today. So with racial discrimination, we define it as the unjust or prejudicial treatment of different categories of people on the grounds of race. We've known within the literature that at least 90% of Black adults and youth as young as 8 have reported about one annual experience of discrimination a year. But colleagues of Dr. Salim and I recently discovered up to 5 instances of discrimination for Black youth, given the advent of web-based and online experiences. So the numbers have been sorely underestimated, likely for years, given such advances in technology. The reason that we're able to get to this 90% number or these 5 daily experiences are because discrimination types and experiences differ. So on the one hand, we might see something in vivo, which is in person or a personal experience, as a common form of discrimination. But from what we just saw in the video with Jordan Davis or more recent instances which we'll be discussing throughout, such as Ahmaud Arbery, we're understanding that the vicarious or the secondhand or watched experience of some of these even live videos that have been streamed over the past few years can have an impact on us psychologically and physiologically as well. So both in-person and secondary or secondhand experiences can lend to that 90% number. Additionally, we have objective and subjective experiences. So there are some things that people can agree upon more generally. If there's a cross burning in the yard, for example, that's a very objective and standard race-related experience. But subjectively, we've got instances of clutching a purse or walking across the street or doing things that might resonate for one person as a racially discriminatory experience, but not for all. So again, that 90% number can take into account things like microaggressions or micro instances, which some people might agree are racially discriminatory and others might not. And finally, for those that take a look at racism and the different levels in which it plays out, there are so many different ways that racism may impact an individual. So interpersonally, between two people, institutionally, which might be an institutional mandate or policy, systemic things that have been happening over time, historical things that have had markers in one point of time that continue to resonate. These are all different ways in which racist experiences might impact an individual. So again, when thinking about the 90%, we're conceptualizing how all of these elements might play out for an individual. Additionally, with respect to how discrimination turns into racial stress and trauma, we know that symptoms from emotional pain caused by discrimination might be something that folks experience as the event is occurring, but it also might occur differently for folks. So if there are experiences that I am having that might cause quite a bit of emotional distress in me, if someone experienced that same event, it may not cause the same type of outcome or distress for them. So it could be a differential experience, and it could be at different times. So maybe something that occurred for me, discriminatory, with respect to discrimination, may have caused an acute sense of distress in the moment, or maybe it took time. Maybe it was chronic for me, or maybe it was a one-time instance. But there are different ways in which the impact of discrimination play out for various individuals. And that stress that people might experience from these discriminatory events have been linked to both adult and youth outcomes. So I think it's fairly common that we talk about it for adults, but for youth, these things manifest in the academic space, so that can be a play on their cognitive capacity or their ability to concentrate in a classroom setting. Psychologically, their distress, or even physiologically, so their heart rate, BMI, et cetera. So these instances that occur so frequently for Black youth not only have distressing outcomes, but they can be connected to trauma, which can manifest differently for each individual child.
Describing relationships, stress, and trauma. But what is racial stress and trauma? How do we actually define it? And how is racial stress different than post-traumatic stress disorder?
Thanks, Selena. Oops, I realized there's a way to accidentally, so I'll just allow Selena to mute really quick. Okay, great. So this is Dr. Farzana Salim, and Dr. Rihanna Anderson opened us up at the beginning and really provided a nice introduction to understanding kind of the foundational definitions of racial discrimination and racial stress. And I think Selena's first question is a really good one that a lot of people ask us in terms of, what is the difference between experiences of racial discrimination that youth are experiencing and kind of this idea of racial stress and trauma. And so, we want to acknowledge that, not all racial discrimination experiences will be traumatic. So there are going to be some racial discrimination experiences that might be stressful, and then there might be some that kind of accumulate over time to become traumatic. And so when folks often define it, one way we can define kind of this idea of racial stress and trauma is thinking about kind of dangerous or frightening race-based events, stressors, or discrimination that overwhelm one's coping capacity and impacts quality of life and or cause fear, helplessness, and horror, right? So these are, when we start going to the idea of talking about racialized trauma, these are experiences that then begin to threaten our safety and cause impact in our daily life functioning. So again, not all racial discrimination experiences are going to lead to this, but it very well can be that there's a single incident or there are the accumulation of incidents that can cause racial stress and especially racial trauma. And so when we talk about racial trauma in particular, some folks again ask, how is this similar to something like we think about post-traumatic stress disorder, which is a common trauma and stressor-related disorder within the DSM, or basically the manual that contains all of the mental health diagnoses and disorders, right? So what we often say is that it is similar in terms of when you look at the criteria for PTSD, you might see a lot of the same kind of areas or symptoms, but one of the big differences is that again, it could be the racialized experience could be a single incident, or it could actually be the accumulation of multiple incidents that are race related that then cause this stress. And then in addition to that, I think it's really important to think about this idea of racialized experiences being a potential trigger for trauma symptoms. So we'll talk about that in just a bit in terms of how we even kind of conceptualize that, but this is something that can cause and manifest trauma-related symptoms for youth.
And so why do you think providers consider racial stress and trauma, or RST, to be a myth?
So I'll start us off here. So in terms of thinking through why providers might be thinking about this as a myth, it's because I think when we look at our traditional conceptualizations and understanding of trauma within the literature, folks don't often necessarily think of racialized experiences coming to their mind first, right? So it might be something like being in war. That's a really common one. Maybe being in a house fire, right? But then there's also these instances where we think about things like community violence, witnessing or experiencing that. And then there's also this idea of it having a contextual layer of race that is impacting it, right? So it might be an example of seeing someone on the news who looks like you, who maybe is your age, who has been shot and killed for a racialized experience, right? So racialized encounters, for example, with the police that lead to this. So there is a contextual kind of understanding of race being important that maybe providers may not have traditionally thought of when they were thinking about trauma-related experiences.
I certainly think, Dr. Salim, that the experiences that people even have within the literature is a really important conceptualization as well. So for folks who are studying discrimination, looking at the way that it's discussed as in perceived, right? This element of a perceived experience. And there are really only two ways of having a sensory experience, right? So you can perceive it and you can you can experience it or you can perceive it, right? So one can say that this thing has objectively happened, and then others might say, well, that's just a perception, right? And so as we talk about discrimination within the literature, it's actually quite challenging that most of the literature would require us to talk about it as a perception, and yet when people are objectively stating, this is what's happening, this is what I'm seeing, this is what I'm going through, it can even change the way that providers then believe what it is that these clients are saying, right? If we have to earmark everything as something that's perceived rather than their experience, it would be easier then to discard some of the experiences of our clients as something that they are just contending with in their mind. But when we think about any experience that our clients are having, there might be a perceptive element to that, right? So perception is really something that throughout depression, throughout self-esteem, throughout any of these things that we might be talking to our clients about, has an element of what do you think or what do you subjectively feel about this thing, and yet we don't spend a lot of time calling those things perceived. So again, I think the way that we even describe it within the literature can play a role in the ways that clinicians themselves believe their clients with respect to their experiences. So,
Dr. Anderson, we have a question in the chat box that ties directly what you've spoken of. It says, since RST is different than PTSD, can it be diagnosed and treated as a condition?
So that's a great question, and one that we'll absolutely be getting to throughout the course. So if it's okay with the listener, we are certainly going to hop onto that point in just one or two more slides. So we appreciate your rolling with us as we continue the presentation. And in fact, this slide, I think, is actually going to open a bit of that up. So with respect to what racial stress and trauma is, if we don't believe that racial stress and trauma is a real thing, it can lead to clinician oversight. So in that way, we might be able to properly assess, diagnose, and treat certain clients with various outcomes. But with respect to racial stress and trauma, that might be an area of misassessment, misdiagnosis, et cetera. But if we have the understanding of racial stress and trauma as an actual experience, it can lead to appropriate treatment decisions and rapport building. So with respect to what we'll be presenting today, what we're trying to do is get this understanding of the etiology, the trauma, invalidation of trauma, and for some, it might cause folks to erroneously believe that racial trauma is a myth. And so Dr. Salim is going to explain a bit about how we want to demystify or demyth this idea of racial stress and trauma.
Yes. So what we, Rihanna, Dr. Anderson, and another colleague, Dr. Williams, and I thought through kind of this idea of how we are conceptualizing and thinking about racial stress and trauma happening for youth of color. And I'll mention that again, that these experiences can happen across folks of color, even though today our presentation is really highlighting and focusing more on the experience of African American and Black youth within the United States. And so we really do want to talk about the generalizability of the model, but we'll be giving specific examples more so and talking about this from the experience of Black youth in particular. So this is a quick snapshot of the model. There's a lot of images and boxes here. We're gonna talk through this a little bit just to make sense of it. But what you can quickly see in the overview of it is that there's historical trauma for communities of color that have to be acknowledged. And I think that is kind of the first piece of thinking through how historical trauma has really, there are several studies empirically that have talked about how this, it can be encoded and passed down in terms of epigenetics within our history in terms of historical trauma, whether that's slavery or genocides that we're thinking about that have kind of this biological coding, right? And so then there's also these experiences that individuals have that are race-related experiences and events. And that these events can then lead to a traumatic reaction or a traumatic symptoms for individuals, such as the same areas that we see within the DSM, like re-experiencing intrusion of the trauma or incident that happened. It could be avoidance or not wanting to go near a particular situation or reminder that reminds them of that. It can also be kind of negative mood and thoughts, right? So feeling down, feeling low, having negative beliefs or worries. And then there can also be physiological arousal, right? So having, heart rate, for example, increase during thoughts about these things or experiences of these things. And it's important to also recognize that this can be both direct and this can also be vicarious. So these things can just like if we witness a car accident, right? If we witness racial trauma, that can also lead to some of these symptoms. And so we'll talk about as well, and I think on the next slide, these boxes that are out on the side in terms of the importance of development and also the importance of context of this experience. And we'll also, Dr. Anderson will be leading us in the session towards the end about thinking through some treatment and prevention ideas around this.
Okay, thank you so much for that, Dr. Salim. So if we were to summarize what the DEMYth-RT model is trying to do, there are a few key elements. So it's acknowledging the reality, again, of racial stress and trauma and the consequential symptoms within developmental periods. It provides an ecological framework for how racial stress and trauma can impact symptoms, family, and community systems that the child is embedded within. And it illuminates, again, how prevention and intervention approaches may interrupt the transmission of direct and vicarious processes to youth psychological expression and well-being. So again, these are all things that Dr. Salim just indicated, but these are the three main takeaways of what our model is trying to do.
And I also want to mention too, before we kind of jump through to this idea of prevention and intervention on this, is that, you know, I alluded to on the previous slide that the importance of development is really essential, and when we're thinking about this too, right? So, so when we're thinking about the idea of age, for example, for youth, it is really important that we are conceptualizing that in the experience of racial stress and trauma. So both how symptoms manifest as well as how they're treated. And this is an example of
So in really underscoring what Dr. Salim was indicating, if you take a look at this developmental period here, there are, of course, sensitive times. There are times in which youth experiencing some of these elements like a racist event or some of the family processes or contexts, et cetera, are really going to be dependent on their age. And so within the paper, which we really want to encourage you to take a look at, which not only steps through each developmental period, but as Dr. Salim was indicating, also across various racial and ethnic groups, you're able to see how a racist event for a particular child at a particular age is going to manifest differently, and how they are going to take some of the community or familial elements differently at that age as well. So again, we're going to deep dive a bit into some of these, but the paper we really encourage you to take a look at for some more impact there.
So what are some of the clinical and community-based interventions that may be used to mitigate racial stress and trauma in children, youth, and families? Dr. Salim, Dr. Anderson.
So yes, so Selena, we are going to actually dive into this just in a couple of minutes, but I think before we even do that, we just wanted to kind of quickly highlight this idea of kind of thinking about protective factors. And so when we think about racial, stress and trauma for youth, one thing that Dr. Anderson mentioned and that the video really highlighted is that these conversations around race and managing racial stress and trauma can be very stressful and can be really challenging. And you often hear families of color talk about having this talk, right? And within Black families, that in particular is considered this talk of preparing their kids for walking out in the world as a Black individual, right? And so when we talk about the talk, we often call this within the research literature racial socialization, or communication about race to youth and kind of how to prepare for and manage discriminating, right? So there's different aspects of socialization, and Dr. Anderson's going to talk about this in just a bit, but that can be things such as, instilling pride in your child to help them when they are experiencing discrimination. It can be preparing them for bias, and it can be kind of giving them coping strategies and tools, for example, to help them manage racial discrimination. And so it's really important that we think about this in the context of helping youth manage these really stressful and challenging situations regarding race and trauma.
Sorry, everyone. These are some really finicky buttons here. So one moment. Here we go. So just one follow-up on racial socialization that I think is quite important to what Dr. Salim was saying. These are processes that typically occur for families. So say, for example, 2/3 of all Black families indicate having the talk with their children. What's really important and what we should be mindful of as clinicians is if there's a strength that Black families are already reporting, if they're using these clinical skills, these coping skills within the family, it's really incumbent upon clinicians and treatments to dovetail as much as possible to learn from what communities and families are already doing and thinking about how can we support what these families are doing versus creating completely new structures or taking perhaps either a theoretical or a practical element and trying to change the ways in which families are engaging with each other. So that's one other thing to think about with respect to racial socialization and what's really undergirding some of the interventions that you'll see on the screen here. So we won't take too much time going through these, but we wanted to provide them for you so that you're able to see what folks are already doing. So the Black Parenting Strengths and Strategies program is a parent-focused program for parents of younger children, a group-based program in which Black parents are talking about, again, the strengths and strategies that they have for raising younger children. So it might gloss over some parenting elements more generally, but also brings in those racial elements that are important in raising Black children. Similarly, for Strong African American Families programs, you have some focus on rural families and what it is that reducing some risk factors like aggressive behavior and sexual risk might look like for families within the South, so the rural South. So that's a program that you might want to look at there, the SAFE program. With respect to play, preventing long-term anger and aggression in youth, Dr. Howard Stevenson developed a way in which folks can utilize play, utilize some of the natural developmental processes that you might see for younger adolescents to engage with parents and team members and coaches in ways that allow them to express externalizing behaviors when they have experienced frustration from race and racism. So the play program is something that you might want to look at for some of those elements. And I'll spend just a moment talking about the program that was mentioned at the beginning in our introduction, the Engaging, Managing, and Bonding Through Race program. So I'll take a moment just displaying some information about that. So Embrace is one of the few programs that focuses explicitly on this idea of racial socialization with the goal of reducing race-related stress and trauma in Black children. It's one of the few programs that also takes into account parents and children and clinicians. So the goal is dual in that we're not only trying to reduce some of the problems that Black youth are experiencing, but we're trying to better educate and better train clinicians to deal with some of the race-related stressors that might come up in session. So briefly, it's 5 sessions that we use in concert with some of the elements that Dr. Salim already indicated racial socialization takes into account. So what we're trying to do is increase parent and adolescent socialization competency, or the ways in which families are able to confidently and skillfully socialize with one another. We are aiming to reduce the parent and adolescent racial stress and trauma through things like self-efficacy. I can do it, I can address these issues, and I can do them well. And I can cope with these things effectively when they happen, not if, but when they happen, we're able to actually do something about it as a family unit. And those things will lead to improved adolescent psychological and academic outcomes. And there are a few citations that I can point you to, the one at the bottom of the screen here, and also an Anderson and Stevenson 2019 paper that will show you some of the pathways that we're hypothesizing some of those intervention development ideas for. Finally, we're really just trying to develop skills in how folks engage in this content. So how can folks talk about race more effectively? How can they manage the stress that comes specifically with racial discrimination? Because we know racial discrimination as a stressor is unique and requires specific management skills to contend with. And bonding. So how can you talk about something that's really challenging and really stressful and frustrating for everyone while still having strong family bonds? Just to show you a bit of the findings, Dr. Salim was a clinician on this program. I've been a clinician and the developer on it, so we can all speak to some of our experiences, but here are some of the things that our clients have indicated. So for one youth, they indicated it felt good because like we can talk about like what we've seen, so like we won't have anger built up inside of us, which points to some of the internalizing issues that people have with experiencing racial discrimination. So you're seeing the ability for people to talk about and then open up to, instead of having things erode on the inside or really damage psychologically or physiologically, they're able to get it out. A parent indicated it was empowering. It opens up, like, obviously a different conversation that you wouldn't typically have with your child. So for me, it was empowering because I feel like I'm teaching him, like, you know, this is going to happen, but this is how you react. So just to put an asterisk here, when a parent is saying it opens up, like, obviously a different conversation, this is really key for clinicians, because if it's not even happening within the Black family home, which most of these Black families are already engaging in, then really it's not happening in therapy. We're not really creating space for people to talk about racially specific issues. So this is really key to having a racially specific intervention for racially specific stressors. And finally, a parent indicated, well, prior to Embrace, I thought I was well informed about how my child thought about certain situations. Since Embrace, I now listen more and encourage more communication from my child. So again, just another head nod to this idea that in therapy, we may not be addressing stressors that are impacting our children or our families on a fairly regular basis. And finally, we just want to show you what some families are talking about and how they felt about having this opportunity to talk about race in particular. So my goal here is not to encourage the use of Embrace per se, but really to show what a racially socializing intervention or a racially specific intervention can do for families. So take it away, Sarah.
Thank you, Dr. Anderson and Dr. Salim, for sharing with us about the DEMYth model and also clinical and community-based strategies that may be implemented within our communities. We all know that we're in the middle of a pandemic, and not only have we seen an increase in hate crimes towards Asian American families, but also reported incidents of the criminalization of African American people of color while wearing homemade masks. And some researchers report that people of color may choose not to wear a mask for fear of retaliation. Would you describe these COVID-related incidents as racial trauma, and how should these issues be addressed by families and systems?
Yeah, so I'll start by talking about, I hear some feedback. Okay, great. So I'll just start by talking about the importance of this topic, because this issue is great. So a lot of people have been asking, you know, is this something that can be racially stressful or traumatic? And so our response is absolutely. There's kind of this catch-22 in some ways, because we see that particularly within the Black community, we've been seeing all these news reports that you know, Black folks are either, it's been phrased as, are more likely to get coronavirus or more susceptible. But we know that in reality, it's not about that. It's about the historical kind of systems and institutions that have kind of limited access to healthcare and being able to take advantage of preventative health, and also just thinking through the types of work that some communities might be more likely to engage in or more likely to do, right? So being on the front line, so that increases both exposure. And when we think about institutional systems and we think about the history of groups, it's really important to think about kind of, again, that access to care that's really important. So in some ways, it is this idea that individuals feel like they need to take precautions when they're going out, for example, wearing masks, but at the same time, if you feel like you might be targeted because you have on a mask, because people think, here is, I'm more likely to be approached or have racial bias occur when I'm out anyways, but then now I have on a mask and I'm walking around. Am I going to be more likely to be approached? Am I going to be more likely to be followed or have a negative consequence happen with me trying to take precaution via wearing a mask? But then that also might mean that I'm portrayed in a scarier way, right? That might threaten my safety. So there's that I think is very important. And at the same time, not wearing a mask, we know that can increase exposure to it. So I think that it adds another element of kind of worry and anxiety and risk in thinking about what are the benefits and the consequences of me taking precaution and wearing a mask and kind of being out. Dr. Anderson, do you want to talk some about kind of the reality of the importance of this topic, and then also thinking through some of the things we discussed about kind of the multiple levels that are important in terms of how people can be safe and then also be mindful of race when they're out and thinking about COVID?
Sure. So one thing before I jump into that, another element that I think is really important during this crisis is to think about this idea that I keep bringing up of community lament. So with grief, we all know that grief can be compounded, cumulative. There's so many ways that grief can manifest. So we know because of the disparities that Black people are likely to know someone or have been impacted by COVID personally more than other folks. But we're also trying to understand what it means to, as an example, I'm a Detroiter, and wake up to news that my city in particular is being impacted in ways that are hit harder than other cities. So to know that Black people within Detroit are being particularly hit hard, that is really challenging to contend with, even if I am not personally experiencing COVID or if I haven't had family members that have experienced it. So to think about, again, how we expand this notion of what racial stress and trauma looks like during this time it's a present-oriented moment, right? Like we're trying to understand it as it's happening. But this also begs the point that Dr. Salim made earlier, that while PTSD diagnoses are typically focused on things that are happening in vivo or directly, we really need to make space and room for these vicarious and now community-level issues that are happening, particularly with respect to COVID. So we appreciate understanding these challenges as it's happening right now in the moment. But I actually think, Dr. Salim, you made some excellent points, and what I would love to do is open it back up for people for questions at the end. So I won't belabor how folks can stay safe at this time, but I really just think it's important for us to, as clinicians, to get a full grip and grasp on how COVID can impact Black youth in particular when we think about grief, loss, community lament, or personal loss as well. So I'll wrap my comments up there. And get the next slide, Sarah. Thank you.
All right. So in conclusion, we just want to really have a couple of take-home messages from today. So we just want to have folks recognize that racial stress and trauma is real, right? So it's not a myth. It is something that's real that impacts youth and families. And we hope that through DEMYth that it can help provide some sort of conceptual framework and context for how racial stress and trauma can impact youth, and how development is really important. And when we're thinking about both the experiences and the manifestation and the treatment of racial stress and trauma for youth. And we also think that, thinking through interventions like Embrace can help alleviate the impact of racial stress and trauma for families, right? So what are interventions out there? What are tools out there that we can really use to help support youth who are experiencing this? And again, we also think that it's very important that we have not only awareness, but responsiveness across systems to be able to address this for youth. So both, thinking about the family level, but thinking about the community level, schools, administration, and even kind of political level, right? So when we talk about this experience of racial stress and trauma, that there are multiple ways in which we are addressing this issue to be able to support the health and development of youth of color in the United States. So we are so excited to have been here with you all today, and we're happy to take questions.
Thank you so much, Dr. Salim and Dr. Anderson, for sharing your knowledge and expertise with us. We do have a few questions here in the chat box. The first question is, what are some common misdiagnoses for youth of color?
Yeah, so I would be curious from that person to hear a bit more about the context of what they're interested in, and I'm wondering if they mean across all different aspects of disorders. I would say that what I've seen often within the research literature is that, particularly within the Black population, that oftentimes Black youth might be more likely to be diagnosed with something like a disruptive disorders, right? Or might be more likely to be labeled with behavioral disorders, where sometimes it might be something related to mental health difficulties that are going on. Sometimes it might be that, some symptoms of trauma, and again, this can be related to racial stress and trauma too, could manifest, or the symptoms could look similar to other disorders like ADHD, right? So in terms of feeling anxious or keyed up, feeling, having a hard time concentrating, these are things that we see across different disorders, like, for folks who aren't familiar, a disorder related to attention or hyperactivity. So that's what I'm referring to when I say ADHD. So we might see some of those symptoms which could overlap with symptoms in trauma, including racial stress and trauma. So those are a couple of disorders that I would say might be overdiagnosed, particularly for Black youth, and it might be that those might be misdiagnosed or overdiagnosed due to some context of bias, for example.
And that's great. And I'll add just two more quickly that I'm thinking about. So a lot of my work recently has focused on what depression looks like in Black children, and the ways that racial discrimination are related to virtually any diagnosis for Black youth. We know that Black youth tend to be diagnosed less frequently with most diagnostic criteria, but with respect to discrimination, the more aggravated discrimination is, the more we see depression-oriented or anxiety-oriented findings, particularly for girls as they increase in age in adolescence, and as Dr. Salim indicated, for externalizing issues within typically school-based settings for boys. And so those are some of the differential diagnoses that we would see there. I think we'd be remiss if we don't indicate, again, this developmental perspective in saying that as Black folks who experience racial distress get older, that might also be misdiagnosed for some elements of schizophrenia, right? So if you are, quote, paranoid about someone looking over your shoulder or approaching you as a authority figure, that can be misconstrued by people as some sort of paranoid related either schizophrenia or disorder. So just being mindful of what that might look like developmentally as well.
Thank you so much. Another question we have is, how do these interventions apply and affect adopted Black youth?
So I would love to jump in on that. So the most interesting, I think, element of Embrace and other types of interventions is really to understand who the client is. So who we're trying to identify here receiving treatment. So if Black youth are the folks that need to understand that they can cope with, they can contend with, they can work through the various elements of a racialized society, we're talking biological parents, we're talking caregivers, we're talking grandparents, we're talking mentors, teachers, clinicians. Anyone who's working with Black youth should be competent and should be able to talk to them about this. So whether that child is adopted and whether that, I'm not sure if the question was also about an interracial adoption for that matter, we're talking about anyone who's engaging with Black youth needing to understand that Black youth are facing a racialized world around them that frankly is not looking for their best interest, right? And so we're trying to figure out how do we protect Black youth from some of these challenges that they're facing, and how do we, as any provider, caregiver, et cetera, of Black children, feel comfortable and competent enough to talk with them so that our children are protected, right? So that's the goal of Embrace and other interventions in which we're thinking about how do we extend this idea of parent or caregiver to anyone who might be engaging with Black children, whether that person's race matches or not.
All right, and one final question. Has the RST concept been used in legal cases?
So to our knowledge, it has not been to date. However, we're hoping that the model and this work really is shared across disciplines and across sectors to discuss the reality and the impact that racial stress and trauma can really have on youth. Dr. Anderson, what are your thoughts about this?
So I'll add that one of our colleagues who is working on the paper, Monica Williams, I know uses some of these constructs across a great group of folks. Another one of the giants within the field, Robert Carter, developed the race-based traumatic stress scale for forensic patients. So it actually likely has been used or advanced in some legalized settings, but it is a lot of the work now is thinking about within clinical work, how do we expand this idea of PTSD to either include a racialized component, or how do we have a new construct of racial stress and trauma so that we're able to talk to insurance agencies about the accurate, way in which we bill or code this. And I'll say just briefly, one of the challenges though, by Carter and Williams is that we don't want there to be a client-facing problem. So it is not the client's fault, and you'll see this a lot in Carter's work, as with the use of the term target. So if a client is targeted, they are the target of what's happening in the world, then why would we want to put blame or onus or a label on the client when really there are issues within the world? So I say this because it's still something that I think folks are working through, whether it's being used for legal or case law or whether it's being used for clinical work. But there really is this notion that this, among the other types of clinical diagnoses, is one of the few that really says, society is the thing that is impacting folk of color, and so why should we be the ones to have the label? Why should we be the ones to have the diagnosis? But again, on the other hand, we want to be able to appropriately diagnose and code and give treatment towards. So it is a challenging thing to contend with.
All right, well, we will wrap it up there. Thank you again, Dr. Salim and Dr. Anderson, for increasing awareness with our audience today on racial stress and trauma and sharing your model. We actually have a link to their article in the Family Process Journal, as well as other resources to support youth of color. And go to the next slide. Our next webinar is Suicide Prevention in African American Youth. It's scheduled for Thursday, July the 16th, 1 p.m. to 2 p.m., and the link is there for registration. I'd also like to share the contact information on the next slide. of our presenters in case you'd like to ask additional questions or learn more about the DEMYth model. The emails are listed there. And again, we thank you for your participation today. The slides will be emailed out to you, and we ask that you stay on just a few moments to complete our survey. Thank you, and please be well and stay safe.